is a baby from Nigeria, came here to Kim's hospital for the heart problem. The baby is 8 months old and has got a complex congenital heart disease. The name of the disease is called truncus arteriosus. In this condition, the baby presented quite late, about 8 months old, and she was seen by her doctor, by the doctor there, the cardiologist in Nigeria, who referred here for us for surgical treatment. This condition called truncus arteriosus is not a very uncommon disease in children with complex congenital heart diseases. In this condition, the tubes which come out of the heart, they basically, normally there are two tubes which come out of the heart: the aorta from the left side and the pulmonary artery from the right side. And in this condition called truncus, there is only one tube which comes off from the heart, that is called the common trunk, and this tube gives rise to both the aorta and the pulmonary arteries together. But the problem in this is there is only one valve. Usually in normal case there are two valves, but this tube has got only one valve. So in addition, there is a big hole in the heart between the two lower chambers. The entire spectrum is called truncus arteriosus, and it is a very complex congenital heart disease. And with this disease, the baby presents to the pediatrician and, with congestive heart, with heart failure and inability to feed. As you can see, the baby is 8 months old, and the baby is just weighing about 4 kilograms. When the baby came to us in gross congestive heart failure, treated medically initially, and then we had to do a major surgery to give a new life for the baby. This surgery means the big hole in the heart between the two lower chambers called the VSD has to be closed. In addition, we have to divide that common trunk into two parts. That means we have to separate the tube which goes to the lungs from the common trunk which takes blood to the aorta. Now when we separate it, we need a valve. So fortunately in KIMS we have our homograft valve bank, which is donated by human donors, and we store it in this is through our Jivan Dan project of the state run the scheme, and we store the human valve, the human valve, the pulmonary valve, that's called homograft, in our own blood bank, and use it to give a new life for kids like this with problems where there is no pulmonary valve, there is a pulmonary valve absence. So the surgery was done very well, and the baby did very well, recovered slowly, and had some issues in the postoperative ICU with lungs. It was managed by the critical care team very nicely, and the baby is we made a very good recovery and is ready to go home back to Nigeria to her doctor.